What's more important for our health than cholesterol and blood sugar or even insulin resistance? Well, maybe visceral fat. I had a recent interview with Dr. Sean O'Mara, an MD who has really devoted his career to diagnosing and eliminating excess visceral fat. So what is visceral fat? It's the fat that surrounds our organs, mostly in our abdomen, like surrounding the liver and the pancreas. And it actively secretes inflammatory compounds and increases our risk for a whole host of chronic diseases, from type 2 diabetes to cancer. And as Dr. O'Mara mentioned, visceral fat also surrounds our heart and has been implicated in an increased risk for heart disease. Now, as a cardiologist, I'm intrigued by this connection, and I was fascinated to find studies suggesting there's an independent risk from epicardial fat. One study re-examined CT scans from patients who had a coronary calcium scan, and they found a small independent risk for all-cause mortality for those with increased epicardial fat. And the highest risk of all was seen in those with both high calcium scores and high epicardial fat. And another study in China showed more than doubling risk for coronary artery disease for those who had elevated epicardial fat. And as the amount of fat increased, so did the risk. But fortunately, as Dr. O'Mara mentions, there are actionable steps we can all take to reduce our visceral fat and improve our overall health. So his recommendation, first and foremost, is avoiding ultra-processed foods, especially processed and refined carbohydrates. And in our interview, he provides a really drastic example of one of his patients reducing visceral fat with just this one simple single intervention. But second, he also talks about managing chronic stress and getting restorative sleep, as both of those, poor sleep and high stress can both increase cortisol and contribute to visceral fat. And third, exercise, obviously important, but specifically he mentions sprinting, but sprinting done in a way that's safe and builds gradually to prevent injury. So sprinting can be really intimidating to many people, and for good reason, but with a well-planned progression, it can be a powerful intervention for reducing visceral fat. And fourth, he recommends intermittent fasting. Now, in discussing this with him, he said it can range from simply skipping a meal to up to 72-hour fast, something that he does, that he frequently recommends. But along with the intermittent fasting, he recommends eating a living carnivore diet, meaning mostly meat with fermented fruits and veggies, that he says will feed the microbiome, and making sure one is getting adequate protein, especially to counter the periods of fasting. So he says we shouldn't just be fasting and eating, but rather we should be fasting and feasting. So very interesting approach. Now, with those interventions, Dr. O'Mara has seen dramatic reductions in visceral fat in his patients. But what about diagnosing it, right? How do you know if you have visceral fat? Well, and this could be the tricky part, as it isn't as simple as walking into a doctor's office and getting a blood test. Instead, it requires an MRI or a CT imaging study, which can be expensive and sometimes hard to find. But one hidden gem could be looking back at any imaging study that someone's already had and having an experienced doctor relook at the images, because most of the time there's some visceral fat there, even if it wasn't mentioned. But in Dr. O'Mara's opinion, it is definitely worth the financial investment to get an imaging test to diagnose excess visceral fat. And we can always wonder what the future will bring. Will we see a future with insurance coverage for imaging to detect and follow visceral fat? I mean, it may hold a secret to helping people take action to combat our chronic disease crisis. But guess what? I mean, even if you don't have an imaging study quantifying your visceral fat, you can still institute the lifestyle changes to improve your metabolic health. That will also likely reduce your visceral fat. And I wholeheartedly agree that visceral fat is super helpful, right? Helpful to track and powerful to see if what you're doing makes it go away. But by no means is it the only marker of metabolic health. So for those who don't have access to or choose not to pay for those scans, there's still plenty you can do to track your metabolic health and plenty you can do to improve it. So what do you think? I mean, how far are you willing to go to detect and combat visceral fat? Let us know in the comments as we all try to figure this out together. Thank you for watching. I'm Dr. Bret Scher, and we will see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.